Hello and welcome to the Gift House. I will be your host, Coprice Jones, and I have Dr. Singh with me. Today we will be talking about health promoting among racial and ethnic minority men. How are you, Dr. Singh?
Good. How are you, Coprice?
I'm great. Thank you for being here.
Thank you for having me.
So when we're talking about the health promotion among racial and ethnic minority men, what are we talking about? What is it entailed into the community?
So this study is basically about health disparities among minority men. So we have African American men, Asians, Native Americans, Hispanics. So we focus on the disparities that are prevalent in the community, such as diabetes, hypertension, obesity, sedentary lifestyle, prostate cancer, HIV. So we focus on all of these. So according to our research, according to the U.S. Census Bureau, there are about 3 million people in the city of Chicago. And out of these 3 million people, 402,854 are African American males. Okay, now out of these African American males, 10% are diabetic.
Oh, wow.
Yeah, and 14% are obese. And 23% have high blood pressure. So
Wow.
These are just ridiculous numbers because these are diseases that shouldn't even be in the community. These are things that can be reversed, and they are so prevalent. So this is just in the African American community. If you look at the Hispanic community, you have about 399,000 Hispanic males. And among these Hispanic males, you have about the same rate of blood pressure, their hypertension, they have about 20%, and obesity is 14%. Diabetes is 9%. So it's very prevalent in these populations, and it just shouldn't be there. And this is what really upsets me, because these are things that can be treated and can be reversed just with diet, lifestyle, exercise, just eating properly, all of these, and they're so prevalent. If you look at the Asian community, Asian Indian, which is my community, we have the highest rate of sedentary lifestyle. Sedentary lifestyle is like 34%. So it's a really great number, and we know that sedentary lifestyle, poor nutrition, all of these lead to diabetes and hypertension. In the American Indian population, we have the highest rate of obesity among those men. It's about 30%.
So, Dr. Singh, I hear you when you talk in statistics and you talk in percentages. Is this a grant, or if so, tell me about the research?
This is a grant, and we've researched on these populations and found out these percentages, and our goal is to reduce these percentages. We have a plan on. We're going to have health fairs, and we're going to have healthcare professionals come in, and we're going to have all sorts of a diverse group of healthcare professionals, so that in case there's any language barriers, such as with Hispanics or even Asian Indians, such as my community, if there's any sort of language barriers, that won't be prevalent. We'll have healthcare professionals, nurses, everyone that can speak the language, and we'll give a lot of information on the various diseases. But we're going to target each individual at a time and see what is stopping this one person from getting help. Like, why are they not healthy? Why are they not exercising? Why are they not eating healthy? What's going on? Because for everybody, it's going to be a different reason. And we're going to focus in on each person. And once we can help one individual, we can help the group as a community.
Okay, so when I hear you talk about men, what are the ages? And when we're talking about the African American men, the barrier, because they do not go to the hospital or they do not have regular checkup, how are you going to engage these men to come out? How are you going to get the message across? Because what are the ages of the men that you're talking about? Because we're certainly not talking about, adolescents. When you speak about men, what are the age and how are you going to get them out?
So the ages are from 21 to 44.
Okay.
And you're right, you're absolutely right. It's very hard to get men to come to the doctor. I know women will go all the time, but with men, it's very hard to get them to come to even accept that they might even have a problem. But I think The problem lies in understanding and communication. They need to understand the gravity of the situation. If they see, if you tell me, Dr. Singh, I've had diabetes for 5 years.
Okay.
But I don't check my I don't check my sugars. They go high and they go high and they go low. And I don't diet, I don't exercise, but I'm fine. I don't have any symptoms. I'm good. I'm feeling fine. You're fine now. It's only been 5 years. Wait 10 years or 15 years. After 15 years, you're going to have a higher chance of getting these complications of diabetes, such as limb amputations, renal failure, blindness, heart attacks. Same with hypertension. With hypertension, you're not going to see the complications until 15 years later. You're going to feel fine. Here and there, you might have symptoms if you're not taking your medications regularly, but eventually you're going to have like heart attacks, aneurysms, strokes. These are all complications of hypertension. So the problem lies in explaining this to people and getting it across to people.
So, Dr. Singh, what I hear you saying is these diseases can lay dormant, right? These diseases can come on at a later time, and then in your later in your life, and then maybe you start feeling these symptoms. Mm-hmm. So, why do you think minority communities are much more deprived than any other community? Why is it that there's a disparity in the African American community with healthcare versus the suburbs per se? Mm-hmm. Why is that?
I think it's a lack of resources, maybe a lack of health education. There might be a language barrier. There are multiple things, and that's what we want to focus on. And okay. So those are the things we focus on.
So if we're focusing on the disparities in the communities.
Let me slide in here.
So,
so I have another guest here. Is Mr. Jackson, and he's from the Gift House.
Go back to you. Go to you.
Yes.
Go to you. Go to you.
Go to me.
Go to you. Just shoot right now.
Hello. I have another guest with me. This is Mr. Jackson, and he's from the Gift House at 1309 South Kedzie. His telephone number is area code 773-522-2420. He's at the Gift House at sbcglobal.net. And thank you, Mr. Jackson, for being a guest on the show today.
Thank you.
So, Dr. Jackson, I was talking to Dr. Singh about this grant, health promotion among racially and ethnic minority men. What's your input on it?
Well, it's a great grant. It's something that it's definitely needed in the minority communities, and not just African American communities, as Dr. Cabal was able to express, that it's African American communities, Hispanic communities, Indian communities, Asian communities, and there are other communities that are minorities that aren't talked about as much, but the grant would address those issues as well.
Okay. We have a caller. Hello,
This
caller.
is the thing you're talking about, reason why a lot of men don't go to the doctor, because several different reasons. One, not all doctors are the same, because you got some doctors, they forget they dealing with people. And then a lot of times, we all hate that stuff. So when you go through the, what do you call that, prostate exam?
Yes,
And they put that jelly up in you, and the doctor be done, they tell you can go out, and you feel like you just have an accident on yourself. And you're lucky you get to see the doctor about 15 minutes. And they forget they dealing with people.
Absolutely.
And when they sitting there in that examination room, they feel very vulnerable. And a lot of times it's what is said in that room and how it's said. And men may read things differently the way women do. And that's maybe one of the reasons why a lot of men don't go to the doctor, because doctors forget they dealing with people.
Thank you.
Yeah, that he's on the money. I mean, he's on the money. I can just tell just from the accent that he's African American, And those are conditions why a lot of black men don't go to the doctor.
Okay.
I mean, that's, just on the money and addictive. And that impacts us greater than other groups. And now it's spilling over to other minority groups. And they're having that problem. So you really got to, one, as the caller brought out, one, that you're dealing with a person. And a person requires more a sensitivity when you're dealing with that, especially if you're dealing with an issue of health. What I really want to bring out with Dr. Cabal, because she's a little person, she's full of energy, and
wow,
she's just so dynamic. And the one of the tragedies is that, she's getting ready to do a residency, and she's going to do a residency over in Alabama.
Wow, that's far from here.
Yeah, that's far from here, and we're trying to keep her here.
We have to.
We're trying to keep her here, and I'm trying to. Maybe I'm going overboard, but I would like for her to do a residency here in Illinois, rather than going all the way to to another state. So that's something that we don't want to lose, especially when we have someone of such fire, and she's very knowledgeable. She's very knowledgeable about the research. Unfortunately, the show, we only have a certain amount of time for the show, and we want to just talk about the conditions that really impact men of color. And she would just be, I'm sure you can always go get a doctor to come in. But you're not going to get someone like Dr. Cabal, that she is just so intense. And you're really going to need something like that when you're dealing with a population of people who have been neglected in a lot of ways, particularly in the area of health.
So, Mr. Jackson, let me stop you right there and say, how are we going to regain African American males' trust? How are we going to get the men involved? How are we going to pull them back to be able to trust us or Dr. Cabal? What are we going to do? What is the plan?
Okay, well, the plan of action, great question. Plan of action is the caller brought out. For the doctor that is providing the service,
okay,
he or she needs to realize that they're dealing with a human being, and that person need to be treated accordingly.
Okay.
Okay.
Sounds good.
That caller was just right on the money when he said that, and thank you, caller, for bringing that out, because it's just key. And it's sad because it seems like that would be something that health professionals would know to do, but for some reason it doesn't happen. It just does not happen. And so the other thing is I begin to address the causes. What are the causes of what causes diabetes? Sometimes that cause could be it could actually be hereditary, or it could be a lifestyle. And then if you address those causes, you'll begin to reduce those numbers, as Dr. Cabal brought out. These numbers, these statistical numbers, we're going to try to bring down by addressing the causes. And and that's probably another show for us to get into how we're going to address all of the causes, given the amount of limited time we have. And then the third component, and Dr. Cabal, she touched on it, and the caller even touched on it, getting minority men to come to the doctor. And so, as you see, there's a plethora of things, the causes, reaching out to minority men, and when you do reach out to them, treat them in such a way where they feel welcome to come to the doctor. And when you begin to put these components into play, you'll begin to see a drop in those numbers.
Okay, so we have to regain the trust of the African American male population.
Absolutely.
In the community.
Absolutely.
And so Dr. Cabal I believe that she's wonderful. I know her for being here, and I know her personal, and I know that she's approachable. I know that she's going to be awesome in the community, and I know that people can trust her. You know, I certainly can trust her. So how do you feel, because you are a male, African American male, how do you feel when you go to the doctor? Are you comfortable with every appointment? Do you feel like there's a disparity? Is there a difference between you and maybe a Caucasian male? How do you feel? Because I don't feel what the African American male feel. There's a difference.
Well, there's no such thing as one size fit all.
Okay.
And every individual is different. And when you start crossing ethnic groups, it's now even more diversity. So it's important that we look at that and consider it, because I can't say that my condition, I'm actually a diabetic.
Oh, wow. Okay.
And my condition is the same as a European. His diaspora is completely different from mine.
Okay.
And so, because you have such diversity, the health disparity would be different. It would. So you can't just say, well, as African Americans, they're all going to be the same. You got African Americans that don't have diabetes and probably would never get it. And on the same situation, you have white Americans who have diabetes, and they have a history of it. It could be a situation where that history could spill over into genetics, where the African American didn't have the genetic precursor for it. The white American had it. So people are different, and that is the key, and that is the area that that we really have to address it.
Wait.
I'm sorry.
I'm sorry, Mr. Jackson. So when you say people are different, we understand people are different. So going back to this grant and having the community workshops and things of that nature, will there be literature for everybody who can be able to read? Will it be in layman's term and not all this medical term like hypertension and words that if you're not diverse in the medical field, you may not understand. They may not understand. Will there be literature on the level that people will be able to read and understand? Like blood pressure. They understand blood pressure, not BP, temp, and is it going to be layman's term on there? They'll be able to read and not a lot of medical terminology, and then they have to go seek a physician to break it down. Will there be literature for this?
Yes, it would be designed in a format where everyone can understand it, and it's conducive where it's attracting minority men. All minority men that the Dr. Cabal spoke about, where they feel welcome to say, you know what, I know exactly where she's coming from. I feel comfortable enough to participate. And I don't know if you got a chance to talk about it, but there's a survey that she's using to assess the health needs of the African American men.
Okay. That's good. Well, we're running out of time right now, and if anybody, out there listening and would like to talk to Dr. Cabal, would like to call the gift house to get, further testing, further information, please call us at area code 312. Please call us at the gift house. We are at 1309 South Kizzy. Area code 773-522-2420, or you can email us at thegifthouse@sbcglobal.net, or you can visit our website at www.thegifthouse.org, and we'll be happy to, engage you into conversation, get you out, come out to the community, and we can have a one-on-one with you, but we don't know that you don't know unless you call in and talk to us, and we'll be happy to take your call.